9 popular medications that trigger rapid dementia if you are over 60. A new study just revealed that 9 everyday medications are silently triggering dementia in millions of seniors, with some causing up to 3x faster brain shrinkage. We're not talking rare drugs. We're talking about what's already in your bathroom drawer: sleep aids, reflux pills, anxiety meds, and the scariest part, most of them are drugs you're told are safe. Drugs you've been taking for years, drugs your doctor may never connect to your memory loss. A 20 study published in JAMA Neurology tracked over 490,000 seniors and found that people taking certain medications had up to a 94% higher risk of developing dementia. In this urgent video, we expose the 9 brain-destroying drugs ranked from least to most dangerous, and the number 1 drug. It's still prescribed daily even though brain scans show it can cause permanent hippocampal damage in less than 30 days. Even the MRI scans have shown it literally shrinks your brain in less than a year. Before we dive in, drop a comment. What medications are you or your loved ones taking right now? Let's start with first drug. It looks safe, but it's not. Medication number 9, diphenhydramine, Benadryl, and other over-the-counter antihistamines. Diphenhydramine is one of the most widely used over-the-counter drugs in the U.S. It's the active ingredient in Benadryl, and it's found in dozens of sleep aids, allergy meds, and cold remedies. Millions of seniors use it to sleep, calm down itching, or deal with sinus pressure. But what few people realize is that diphenhydramine belongs to a class of drugs called first-generation antihistamines, and these drugs are deeply disruptive to your brain's chemistry, especially as you age. Diphenhydramine works by blocking histamine receptors in the brain. That's what stops allergy symptoms, but it also blocks acetylcholine, a neurotransmitter essential for memory, focus, and communication between brain cells. As you get older, acetylcholine levels naturally drop. If you take medications that block it further, you're essentially silencing the very signals your brain relies on to think clearly. Over time, that leads to fog, forgetfulness, and eventually measurable cognitive decline. This drug also affects REM sleep, the stage of sleep when your brain repairs and consolidates memories. Seniors often use diphenhydramine to fall asleep, but it actually reduces sleep quality and increases confusion upon waking. That's why so many seniors take nighttime cold meds, report grogginess, dizziness, or disorientation the next morning. It's not just fatigue, it's brain interference. So, what can you do instead? For allergies, consider second-generation antihistamines like loratadine or cetirizine, which don't cross the blood-brain barrier as aggressively. For sleep, talk to your doctor about improving sleep hygiene or using melatonin in low doses, and check your labels carefully. Diphenhydramine is often hidden in PM pain relievers, cold meds, and allergy combos. Even if you don't realize you're taking it regularly, it could still be sabotaging your memory and mental sharpness behind the scenes. If you're already experiencing brain fog, it's worth asking your doctor to review any medications that include diphenhydramine. Stopping this drug even after years has been shown to stabilize or even improve cognitive function in some seniors. It's not too late to protect your mind, but you have to start by removing what's been quietly chipping away at it. Medication number 8, proton pump inhibitors. If you've ever dealt with acid reflux, heartburn, or GERD, chances are you've taken a proton pump inhibitor or PPI. These drugs include popular names like omeprazole, Prilosec, lansoprazole, Prevacid, and esomeprazole Nexium. They're sold over the counter and often prescribed long-term to older adults, but recent research has uncovered a deeply troubling connection. PPIs are now being linked to accelerated memory loss and increased risk of dementia in seniors, especially when taken regularly for more than a few months. PPIs work by blocking acid production in your stomach. That might sound harmless, but your stomach acid is essential for absorbing certain nutrients, especially vitamin B12 and magnesium, 2 of the most critical nutrients for brain function. When acid levels drop too low, absorption declines, and over time a deficiency develops. Low B12 is notorious for causing brain fog, confusion, and in more severe cases, irreversible nerve and cognitive damage. There's also a secondary risk. PPIs interfere with the brain's ability to clear amyloid plaques, abnormal protein clumps associated with Alzheimer's disease. Normally, your brain flushes out waste products during deep sleep, but in people taking PPIs, this clearance process appears to be impaired, leading to increased plaque buildup and faster neurodegeneration. If you're on a PPI, don't stop cold turkey. It can cause a dangerous rebound effect. Instead, talk to your doctor about weaning down, switching to H2 blockers like famotidine, which have not been linked to dementia, or addressing root causes like diet, hiatal hernias, or poor stomach emptying. Lifestyle shifts like eating smaller meals, avoiding trigger foods, elevating the head of your bed, and not eating before bed can dramatically reduce reflux symptoms without risking your cognitive health. Many seniors don't connect memory issues with their stomach meds, but over time the fog creeps in. Names get harder to recall, thoughts get slower to form. You may think it's aging, but it could be your acid blocker. The good news is some of the damage is reversible if caught early. You can protect your brain by getting off the drug safely and replacing what it's been quietly depleting for years. Ready for medication number 7. It's one of the most commonly prescribed drugs for anxiety and insomnia, and it's now directly tied to long-term memory loss and early cognitive decline. Medication number 7, benzodiazepines. Benzodiazepines are a class of medications often prescribed to treat anxiety, insomnia, panic attacks, and even seizures. Names like alprazolam, Xanax, lorazepam, Ativan, diazepam, Valium, and clonazepam, Klonopin are common especially among seniors. These drugs are powerful sedatives, and while they may offer short-term relief, the long-term consequences for the aging brain can be devastating. Benzodiazepines work by enhancing the effects of GABA, a neurotransmitter that calms brain activity. This makes them effective for anxiety and sleep, but as they dampen brain activity, they also slow down memory formation, impair attention, and reduce mental processing speed. In younger people, this might cause temporary drowsiness or forgetfulness. But in older adults whose brains are already more vulnerable to atrophy and slowed regeneration, the effects can be long-lasting and dangerous. The danger doesn't just stop at memory loss. Benzodiazepines increase the risk of confusion, falls, daytime sedation, and worsening depression, all of which are already high in the senior population. They also disrupt sleep architecture. While they may help you fall asleep, they reduce deep sleep and REM sleep, the very stages needed for memory consolidation and brain repair. So even though you're sleeping, your brain may not be resting. Many seniors become dependent on these drugs over time. What starts as a low-dose prescription just to help you get through a tough time becomes a nightly habit. The brain adapts, tolerance builds, and soon you're no longer sleeping better, but your cognition is steadily slipping. The biggest challenge with benzodiazepines is withdrawal. Stopping them suddenly can cause serious side effects, including seizures. That's why any taper must be done slowly under medical supervision. If you're taking a benzodiazepine regularly, talk to your doctor about tapering schedules and alternative therapies like CBTI, cognitive behavioral therapy for insomnia, which has been shown to improve sleep without medication. What makes this class of drugs especially dangerous is how normalized they've become. Many seniors have been taking them for 10, even 20 years, but now we know the longer they use, the higher the damage, and your brain is too important to gamble with. Medication number 6. For many seniors, frequent trips to the bathroom or urgent bladder issues are more than just a nuisance. They're disruptive, embarrassing, and often lead to isolation or falls. That's why drugs like oxybutynin, sulfonisin, and tolterodine are commonly prescribed for overactive bladder. But what most people don't know is that these medications belong to a class called anticholinergics, and they have a deeply harmful effect on the aging brain. Oxybutynin works by blocking acetylcholine, a neurotransmitter critical for muscle control, including bladder muscles. But acetylcholine also plays a vital role in your brain. It regulates memory, attention, and learning. Blocking it in your body means you're also blocking it in your brain, and in seniors who already produce less acetylcholine with age, this suppression can lead to sharp cognitive decline, sometimes within months of starting the medication. What makes bladder medications particularly dangerous is that their mental side effects are often misdiagnosed. A senior starts losing focus, struggling with words, or forgetting names, and it's quickly blamed on normal aging or even early Alzheimer's. Meanwhile, the drug causing it stays in place, quietly deepening the damage. In fact, oxybutynin is considered one of the worst offenders. It crosses the blood-brain barrier easily and accumulates in brain tissue. Seniors taking oxybutynin for more than 6 months have shown measurable declines in attention span, verbal memory, and reaction time. And unlike some other anticholinergics, the impact often continues even after stopping the medication, especially in frail or older individuals. Millions of seniors are silently sacrificing their memory to avoid a bathroom trip. But it doesn't have to be that way. With safer choices and early awareness, you can protect both your dignity and your mind. Medication number 5, amitriptyline. Amitriptyline was once the go-to medication for depression. Today, it's still widely prescribed, but not just for mood. It's now used off-label for nerve pain, migraines, fibromyalgia, and sleep issues, especially in older adults. But while it might ease physical symptoms, what it does to your brain can be far worse. Amitriptyline belongs to a class of drugs called tricyclic antidepressants, or TCAs, and they've been repeatedly linked to memory loss, confusion, and elevated dementia risk in seniors. Amitriptyline is heavily anticholinergic, meaning it suppresses acetylcholine, a chemical the brain depends on for forming memories, thinking clearly, and staying alert. As you age, acetylcholine levels naturally drop. Adding a tricyclic antidepressant into the mix is like shutting off an already dimming light bulb. In younger adults, this might cause grogginess or fatigue, but in seniors, it's been shown to disrupt focus, delay speech, and create the exact kind of mental fog that mimics early-stage dementia. Tricyclics also impair sleep architecture. While many people use them to fall asleep, they reduce the quality of deep sleep, the stage your brain relies on for repair and memory consolidation. That means you may sleep longer but wake up mentally slower and foggier. Combined with drowsiness and reduced coordination, this also increases the risk of falls and injury in older adults. The good news, there are safer alternatives for nerve pain. Medications like gabapentin or duloxetine may be less risky. For sleep, melatonin or cognitive behavioral therapy for insomnia can be far more effective without impacting memory, and for depression. Modern antidepressants like escitalopram are generally safer in older adults, but they must still be used with caution and monitored closely. If you've been prescribed amitriptyline or any tricyclic antidepressant, especially at bedtime, and you're experiencing slower thinking or increased forgetfulness, don't dismiss it as a Ask your doctor to re-evaluate your medication, because sometimes the real cause of mental decline isn't in your brain, it's in your pill bottle. Medication number 4, beta blockers. Blockers are a mainstay in treating high blood pressure, heart disease, and even anxiety. Drugs like metoprolol, atenolol, and propranolol are prescribed to millions of older adults every year. They slow your heart rate, reduce blood pressure, and ease cardiac strain. But what most people don't realize is that beta blockers can also reduce blood flow to the brain, and that reduced circulation is a direct path to cognitive decline, especially in aging adults whose brains are already struggling to stay oxygenated. Your brain uses more energy than any other organ. It needs constant, steady blood flow to feed its neurons and remove waste. When beta blockers lower your heart rate too much, especially during sleep or while sitting for long periods, the brain may not get enough oxygen or glucose. That starves brain cells and impairs the hippocampus, the memory center that is one of the first areas affected in dementia. In older adults, even mild reductions in cerebral blood flow can cause measurable cognitive changes. What makes this more dangerous is how common these medications are. Beta blockers are often given as a first-line treatment in seniors with high blood pressure, atrial fibrillation, or anxiety, but they are not always the best option for older brains. In fact, recent guidelines suggest using calcium channel blockers or ACE inhibitors as safer alternatives when dementia risk is high. These drugs manage blood pressure without compromising brain oxygen levels. If you or a loved one is on a beta blocker and experiencing sluggish thinking, brain fog, or poor memory, don't assume it's normal. Ask your doctor to review your dosage, timing, and whether another class of medication could achieve the same cardiac benefits without impairing brain function. In some cases, even adjusting the time of day the medication is taken can reduce its cognitive side effects. The heart and brain are intimately connected. When one slows down, the other can suffer, and for seniors, the difference between clarity and confusion could be a matter of millimeters of mercury and milligrams of medication. Medication number 3, ibuprofen. Ibuprofen is often thought of as harmless. It's sold over the counter, taken for everything from arthritis to headaches to muscle pain. Many seniors take it daily, sometimes multiple times a day, to manage chronic inflammation and stay mobile. But long-term use of NSAIDs like ibuprofen, naproxen, and diclofenac has now been linked to increased risk of cognitive impairment and neurodegeneration, especially in older adults with already vulnerable brains. The concern is twofold. First, these medications can increase blood-brain barrier permeability. That's the filter that protects your brain from harmful substances in your blood. And when NSAIDs are taken regularly, they can weaken this barrier, allowing toxins, inflammatory molecules, and oxidative stress to reach the brain more easily. Once that happens, damage to nerve cells accelerates, and memory centers, particularly the hippocampus, become inflamed and impaired. Second, chronic NSAID use disrupts the balance of neuroinflammation. While short-term inflammation is part of healing, the brain relies on tightly controlled inflammatory responses. In seniors, where inflammation is already higher due to age, daily NSAID use can actually cause more long-term inflammation in the brain, triggering cellular breakdown rather than protection. A 2018 STEM neurology examined over 700 adults aged 65 and older. Those who regularly used NSAIDs had a 24% higher risk of developing cognitive impairment compared to non-users. Another study from the University of Arizona found that seniors with mild cognitive decline who took NSAIDs daily progressed to full-blown dementia 30% faster than those who did not. If you're over 60 and taking ibuprofen or naproxen regularly for pain, it's worth considering safer alternatives. Acetaminophen may be easier on the brain, though it must be used cautiously for the liver. Non-drug pain relief methods like physical therapy, turmeric, omega-3s, and guided movement practices can reduce inflammation without endangering your memory. Pain is real, but so is the price of protecting your brain, and for many seniors, continuing to take these medications blindly may be accelerating the very decline they fear most. Medication number 2, haloperidol. Haloperidol, also known by its brand name Hodl, is a powerful antipsychotic medication originally developed for schizophrenia and severe psychiatric conditions. But in recent decades, it's been prescribed far beyond its original purpose, especially in nursing homes and hospitals where it's used off-label to calm agitation, aggression, or delirium in elderly patients. On the surface, it might seem effective, but the neurological cost is staggering in older adults, especially those with any degree of memory loss. Haloperidol and similar antipsychotics have been directly linked to rapid cognitive decline, irreversible brain damage, and sharply increased dementia risk. Haloperidol works by blocking dopamine receptors in the brain. Dopamine is a neurotransmitter involved in movement motivation and critical thought processing. When dopamine signaling is shut down, can calm agitation, but in doing so, it also slows the brain's ability to communicate, adapt, and repair. For seniors with already fragile neural connections, this drug acts like a circuit breaker, disrupting clarity, flattening personality, and in some cases, accelerating symptoms that resemble full-blown dementia within weeks. The dangers don't end there. The FDA has issued black box warnings for haloperidol and related drugs when used in elderly dementia patients. These warnings cite a significant increase in the risk of death, often due to stroke, heart failure, or severe sedation-related complications. Despite this, haloperidol continues to be used off-label for behavioral control in settings where staff are under pressure to manage agitation quickly. There are safer alternatives for agitation or confusion. First, assess the cause of pain, infection, dehydration, overstimulation. These can often be addressed without heavy sedation. Non-drug approaches like music therapy, companionship, or even magnesium supplementation can help calm without cognitive cost. If medication is absolutely necessary, newer antipsychotics like quetiapine or low-dose antidepressants may be used more cautiously, but even these carry risk. We're down to medication number 1 next, the most dangerous, most widely used drug still handed to millions of seniors. Even though it's been proven in brain scans to cause hippocampal shrinkage and triple the risk of dementia within just months. Medication number 1, scopolamine and other strong anticholinergics used. Scopolamine, often given as a small patch behind the ear for motion sickness, nausea, or post-surgical vomiting. It looks harmless, it feels temporary, but for seniors, especially those over 65, this drug is one of the most neurologically damaging medications still in use today. Scopolamine belongs to a class of drugs known as anticholinergics, the same family we've mentioned throughout this video, but it's far stronger and more brain-penetrating than most others. It doesn't just block acetylcholine, it wipes it out. Acetylcholine is the neurotransmitter your brain needs to form memories, control attention, and maintain normal thinking. When you block it in a young, healthy brain, it causes sedation or grogginess. When you block it in an aging brain that's already low on acetylcholine, the results can be devastating. That's why studies show even a single dose of scopolamine can lead to delirium, hallucinations, deep confusion, and long-term cognitive disruption in older adults. In a 2020 study from the Journal of Alzheimer's Disease, researchers found that seniors who received scopolamine during or after surgery experienced a 3 times greater risk of post-operative cognitive decline compared to those who didn't. Brain scans revealed noticeable shrinkage in the hippocampus, the region responsible for learning and short-term memory, within just 6 weeks of use. Another study in anesthesia and analgesia confirmed that scopolamine's effects were not just temporary. Many older patients who appear confused after anesthesia never fully regained their previous mental clarity. The risk isn't just in hospitals. Scopolamine is used in motion sickness patches, post-operative nausea treatments, and even in hospice care. These settings often include the elderly or frail, precisely the population most vulnerable to its neurotoxic effects. Once the confusion sets in, it can become difficult to trace the cause, and sadly, many seniors are labeled as having dementia when the real trigger was a single avoidable medication. There are safer ways to manage nausea. Ginger capsules, acupressure, and newer anti-nausea drugs like ondansetron do not appear to cause the same level of cognitive harm. For surgical recovery, anesthesia teams should be informed of a patient's age, cognitive risk, and medication sensitivity before prescribing any anticholinergic. Seniors and caregivers need to speak up because once scopolamine enters the system, the damage can be fast and, in some cases, irreversible. This drug is the final warning because it doesn't just increase dementia risk, it can cause sudden, steep, visible mental decline in a matter of hours. And in thousands of seniors each year, it does. You've just seen the truth. Most seniors are never told these aren't obscure, rare medications. They're everywhere in your nightstand, in your bathroom, in hospitals, nursing homes, and even in over-the-counter azoles. But now you know 9 common drugs, each one backed by science, linked directly to faster memory loss, cognitive collapse, and, in many cases, full-blown dementia. And the scariest part? Most people never find out until it's too late. This isn't fear, this is fact. The studies are real, the damage is proven, and the power to act is in your hands, because if these medications are in your routine or in your parents or partners, you can still step in. You can ask questions, you can request alternatives, you can protect your brain before it unravels. You are not powerless. Your memory, your identity, your future, it's worth fighting for. So now I want to hear from you. Which of these medications surprised you the most? And are you or someone you love taking one right now? Drop your story in the comments. Your experience could help save someone else. Tap like if this opened your eyes. Subscribe for more videos that tell the truth no one else will. And share this with someone who needs it before they forget who they are, because sometimes the most dangerous pill is the one we never question. If you have any questions or want to share your own experiences, feel free to leave a comment below. Thanks for watching.